In today's episode, we welcome Dr. Melissa Prest, a renal nutritionist who's had years of clinical experience helping patients to improve kidney health via dietary strategies. We'll discuss the specific dietary elements that contribute to kidney health and how to use nutrition to tackle chronic kidney disease. Stay tuned. Dr. Melissa Prest is a registered dietitian nutritionist who provides medical nutrition therapy for people living with chronic kidney disease and helps them navigate the kidney diet. She has experience as a health coach with clients worldwide, making behavior changes that allow them to reach their desired health goals. Welcome, Dr. Prest.
Well, thank you so much for having me. It's great to be here.
Great to have you on, Dr. Press. So, first things first, our classic question that we start every podcast episode with: why this, right? So, what drew you to this field of renal nutrition?
Yeah, it's one that a lot of dietitians shy away from. They feel that it's a bit complicated, and I'm sure most people living with chronic kidney disease feel like the diet is a bit complicated. I kind of fell into it in a way of there was a job opening. I was like, I haven't done this before. Let me see what it's about. Let me try it. And it was something that I kind of fell in love with. Not so much the disease itself, but working with people one-on-one for a period of time. My background prior was in hospitals, and so you might see someone once, you just kind of talk to them quickly, and there's really no relationship there. So what I enjoyed is that there's an actual relationship between yourself and the person you're working with.
So, let's get into the basics first, Dr. Press. So, could you explain to us how diet actually impacts kidney health? Like, what is that relationship that exists there, or a sequence of series that could lead to that? And then, what unique challenges those with chronic kidney disease today face?
So, a lot of people that have chronic kidney disease likely have other health conditions. So, typically, it's not just kidney disease, it's kidney disease and something else. And so that becomes complicated in which they're managing two health conditions, three health conditions, whatever that might be. So, high blood pressure, diabetes, those would be our leading causes of kidney disease. And so, there's different diet recommendations for all three of the diets. And so, for a lot of people, it's confusing and a little challenging to figure out which part of this diet fits with this diet, with this diet. What am I supposed to do? This says I'm supposed to do this. This says I'm not supposed to do that. So that is really challenging for people when they are initially diagnosed with chronic kidney disease, depending on what stage they're in. Some people do not know they're in kidney disease until stage 5, into those later stages. And then some know about that earlier. And so if they know about it earlier, they might get a little more information about the diet and are able to learn a little bit more about it and learn a little bit more about managing it. And then sometimes they kind of get on that end where now we have to manage it with dialysis. So in terms of that diet piece of it, there's a lot of different things that we do with the diet because we have to think a little bit for our kidneys because they aren't filtering as much waste and blood. And so we need to help the kidneys kind of do what they would normally do by making some modifications with the foods that we're choosing.
Now, help us understand what are some common misconceptions about the kidney diet specifically that you often address in your practice and the work that you do. And again, help us maybe take us a step back to understand like what are the types of things that lead to that so that it sort of ties into the kidney diet itself.
Sure. So I think one of the biggest thing, which kind of goes back into leads into it. Oop, one second. There goes my AirPod, of course. um, is that I think for a lot of people, they feel like there's a one size fits all for the diet, and a lot of the information that's available on the internet they might find online or even sometimes in physician offices is maybe the most restrictive form of the diet, and it's really not customized for them or differs by stages. So with kidney disease, we have 5 stages. Stage 1 would be really the very beginning, stage 5, 5D, meaning that you're on dialysis. And so, depending on where someone falls in that stage of kidney disease, there's different recommendations for what we're going to do with the diet. Um, Salt, protein, potassium, phosphorus. There's a lot of P words that we talk about with the kidney diet. And so that could be confusing too, where someone might say, "Oh, I'm watching my phosphorus. I'm not eating these foods," but those foods are actually the potassium foods, not the phosphorus foods. So that could get really challenging and confusing as well. So there's a lot of little pieces someone has to kind of put together in this puzzle, which is where a dietitian is really great at helping people put those pieces of the puzzle together.
That's helpful. And as you're sort of thinking through a dietitian's role within addressing this, what are the types of things that a dietitian is able to help someone with as they're sort of trying to manage it, regardless of what stage they're at when it comes to CKD or chronic kidney disease? How does a dietitian's role really help that journey?
So dietitians, particularly if I'm working with someone, and most dietitians that work within the kidney space, we're going to look at the labs. So usually by the time someone's in stage 3, they're getting labs drawn at least every quarter. If it's earlier, it might be annually with their regular visits with their primary care doctor. But it's kind of taking a look at the labs and talking through particular changes in the diet to help them improve or maintain their labs. So a lot of times we're obviously talking about food. We're talking about what you're cooking at home. We're talking about putting together your meal plan, kind of helping you with creating a meal plan. Um, and talking through how we can fit the diet within your life. So it might be helping people who work on the road. They're traveling a lot for work and they're eating out a lot. And so then it's working with them, figuring out, what are maybe some good choices that they can eat at a restaurant and then still kind of be within good guidelines or good places for them with their kidney foods. Or maybe it's a holiday and helping them navigate the holiday, or we're just kind of figuring out that day to day, what kind of things should I be making for myself. So meal plans are going to be really important and things that dietitians will work on, um, in addition to making some changes in terms of how much protein is in the diet, let's say. And that's going to be based on what stage of kidney disease you're at, how active you are, how old you are. So there's, depending on just kind of your overall health, there'll be some recommendations and changes for that. So modifying the diet is something else that dietitians will help people with, and then also just kind of helping setting goals and helping on behaviors and helping on lifestyle. It's not just necessarily like handing out a diet. I think a lot of people might feel like, oh, they're just going to hand me a menu and then send me on my way, and it's a little bit more involved than that. So it's kind of looking holistically at kind of that whole picture of what's going on in someone's life, and then helping them with various lifestyle factors, the nutrition part of it, the cooking, the meal planning, grocery shopping, label reading. So a whole host of things that dietitians help with.
And now diving into sort of the various stages of chronic kidney disease, can you explain the principles of renal nutrition, and how dietary needs change depending on the stage of kidney disease? You talked about the P's earlier, so I want to double click into that to understand how it varies across the different stages.
Yeah, so usually in stage 1 and 2, the recommendation is either a general healthy diet, whatever that kind of looks like for you. So, kind of taking into consideration cultural preferences, what you like to eat, but, kind of keeping that within kind of that healthier framework. Healthy, kind of meaning fruits and vegetables, whole grains whenever possible, kind of looking at those sources of protein. Um, or looking at other health conditions. So as I said earlier, high blood pressure, diabetes, those two leading causes. So it may be working with you to make sure that those health conditions are well managed. So that's like stage 1 and 2. So you might be on a Mediterranean style diet, and that's going to be great. You might be on something called a DASH diet, which is a dietary approaches to stop hypertension. So that would be something that might be prescribed if you have high blood pressure. So whatever type of diet you're following, would just kind of make a healthy plate, and help you kind of manage those other health conditions. So that's 1 and 2. So we're not necessarily modifying a lot for the kidneys. We may start doing some education and talking about those different P words or different things that are going to come up. Sodium or salt is probably one of the first things that we talk about, even if you're at stage 1 or 2. And that just helps the kidneys as they're not being able to filter and clear as much waste from our bodies. They're not able, you're not producing as much urine as you would if your kidneys were working at 100%. And so high salt typically attracts water, you retain water. It's just a little harder to get off, hard for blood pressure management. So we typically will start with that and just your general healthy diet. Once you get to stage 3 and 4, that's when you can see a kidney specific doctor called a nephrologist. That is when Medicare will start paying to see a dietitian. And usually you'll be followed every quarter by the kidney doctor. You'll have labs drawn. They'll check in and see how things are going. And there aren't a lot of medications besides managing our other health conditions that is going to slow or stop the progression of kidney disease. There is some new ones that are particularly geared towards managing blood sugar that have some really great promise in slowing that progression of kidney disease, but there isn't a kidney specific medication that someone can take like we have for high blood pressure or insulin for our blood sugars. There's nothing like that. So what we do have is diet and lifestyle. And those are going to be 2 really important things to really help slow that progression of kidney disease. And so with that, we continue with that sodium. We continue kind of talking about things like potassium and phosphorus and protein, those 3 Ps. But we'll start to kind of modify your protein. So we'll look at the amount of protein that you're eating. And we can also talk about the type of protein. So initially we had some recommendations come out in 2020, again, reinforcing for practitioners who've been working in that kidney disease space for non-dialysis to continue doing lower protein. It's just easier for the kidneys to function. Our kidneys are involved in clearing kind of these end products of metabolism from protein when we eat protein foods. So it's helpful for them to not have as much protein. But then also kind of looking at the type of protein. So those guidelines just had said either type is okay. There were some international guidelines recently released that kind of mentioned maybe the type of protein is important too. So stage 1 and 2, we're kind of focusing on healthy diet, sodium. We get to 3 and 4, continue with sodium, and now we start talking about protein. So we talk about the amounts and the type of protein. So I typically would encourage people to get a mix between animal and plant proteins. It doesn't have to be all or nothing on either way, just kind of whatever works for them. I've had some patients do really well going all plant-based, and then I have others that eat animal proteins mostly, and they've done great too. So just kind of depends on you, but the total amount of protein is what we really focus on. And then the other things that we talk about, but you're likely not going to be seeing changes in your blood work, are things like phosphorus and potassium. They're going to become a little bit more important for people if they progress to dialysis. But in kind of these middle stages, early stages, you're likely not going to see a change in your blood work for those labs. But we still talk about food sources of those and ways to look at things like additives in the food. So phosphorus additives, potassium additives. So phosphorus additives are in our foods for a variety of reasons. Shelf stability, to help things melt that maybe wouldn't melt normally or easily, make things taste better. So, a variety of reasons why we have that in our food supply, and then also potassium additives as well. It's kind of a replacement for salt in some of our lower salt products. We have a potassium chloride added or other potassium additives, which for many people is fine, but if our kidneys aren't working as well, that could be a problem. So I like to, start that conversation and provide some information about those additives so people can kind of start getting used to them, to look for them in their foods and start making other choices. But we're not really modifying high potassium foods, high phosphorus foods in the diet at that point. So we're still just kind of focusing on sodium and protein. And then when we kind of get towards dialysis, we might start seeing then these changes in our potassium levels, our levels for anemia, like hemoglobin, um, phosphorus. We might start seeing some changes. So typically, the kidney doctor will likely add some medication to help manage those, kind of what's going on with that. Our kidneys are involved in making red blood cells. So if they're not functioning as well, it's harder for the body to make these healthy red blood cells. So there's medication that can be added that someone can take to help with that. So I typically see that in people that are later stage 4 into stage 5, not on dialysis. And then again, sometimes we'll see phosphorus creep up. So in addition to the foods, we might also start someone on a medication we call a phosphorus binder. And so that acts like a sponge or a magnet with the food as you eat it to help keep that phosphorus level in goal. And so that's non-dialysis. Once we get to dialysis, things change up a little bit, particularly with fluid. So we start really watching how much fluid someone's drinking. Because again, by the time you're on dialysis, you might not be producing any urine. And so then that's going to just have some swelling and buildup of fluids in your body. We likely start seeing these changes in potassium and phosphorus, so have to make changes in the diet for that. And we end up needing more protein than we did before dialysis because you lose a little bit of that with the treatment. So we want to focus on more protein for that. And often we'll do a kidney specific vitamin as well because we lose some nutrients in the dialysis treatment. And then the very last thing would be transplant. And, that's always kind of like our first line of treatment. If that would be great, if everyone just can get a transplant and not end up on dialysis. But once someone goes through the transplant process and they're post-transplant, usually the diet's just a regular diet. There really aren't any modifications unless there needs to be something if there's high blood sugar or something else that's going on. I know that was a
That's
lot.
Yeah, no, that was quite in depth. And anything one thing that really resonates strongly is like there's a lot within kidney disease. Like based on the stage, you have different considerations, or those considerations evolve drastically as it
Right.
progresses. Which takes me to my next question, which is as you start looking at that, are there any dietary restrictions that need to be kept in mind for patients with CKD, and how does one sort of help navigate that? So specifically when it comes to foods, what are the types of foods that are, and I know it's a broad question, and even as I'm asking it, I understand that it changes depending on the stage. But if you have to provide it, especially to our listeners who either are caregivers for someone who has CKD, have CKD themselves, perhaps on the earlier side, what are the types of things they should look for?
So I generally just encourage people to make sure they're choosing foods that are kind of as close to the farm as possible. So limiting foods that are ultra processed, and mainly because they're usually high in salt. And a lot of times they're going to have these added phosphorus additives, potassium additives in there. So really trying to modify your diet to be more kind of whole foods, more fresh foods, whether that's like a fresh fruit or vegetable or something that's frozen, or even like a low sodium canned food, something like that. So trying to have it as close to like the farm as possible, the minimally processed, is kind of the one thing just to focus on in general. So I guess in terms of like limiting, it's kind of limiting more of these ultra processed foods. And that goes for like your protein options. So if you're doing something like chicken, right? So you want to do maybe like a chicken breast thigh that's fresh and not necessarily like a chicken nugget or a chicken patty. So we really want to be mindful of that. And it goes the same for even um, our kind of like processed plant foods. When we think of like a veggie burger or a veggie chicken nugget, something like that, oftentimes they can be really high in salt. So you got to kind of compare the labels of the foods. So I always kind of start from that processing piece and think about your beverages. So trying to do more of like water or tea or even just some coffee, and limiting things like sodas, right? You have added sugars in there. in things like colas, fruit punches. There's often a lot of added phosphorus in those. So a lot of times patients are recommended to have clear sodas or even things in a glass bottle. So like a iced tea in a glass bottle versus a can. Um, there's less phosphorus in the glass bottle ones. They can heat treat it where you can't do that in a can. So beverages would be the second thing I would say to kind of take a look at and make some changes with that. Um, and then again, it just depends on your labs. So there's definitely like kidney.org has list of foods that would be high or low in potassium or high or low in phosphorus. But I would say really focus on the additives in the foods before restricting like fresh fruits and vegetables. We're not as like a country and as a whole, whether there's kidney disease or not, even meeting kind of our basic minimum for fruits and vegetables. So likely that's not what's causing, changes in like say your potassium level. So let's make sure you're eating our fruits and vegetables, but let's look at the really ultra processed foods. So that might be the biggest change for people with kidney disease is kind of less reliance on these convenience processed foods and really kind of looking at more whole food sources.
Gotcha. I know we're coming up at time here, Dr. Prest, but I quickly want to sneak in this question, which is to say, so as we're talking about the different types of foods, how does proper nutrition contribute to slowing that progression of kidney disease? Could you share perhaps some success stories?
Yeah, I mean, I've definitely have had patients. So I've had one patient who was very, like I said, very dedicated to being on a plant-based diet, and he went from a stage 3 to basically a stage 1 or 2 with his kidney numbers. And again, he was cooking things from home. He was exercising. He was really limiting salt. He was just doing herb seasonings. There is actually a chef that has kidney disease and does a lot with the kidney community. And he as well had just made some really big kind of diet changes. More plant foods really is kind of the common theme here. So more fruits and vegetables and plant proteins and very low salt, and kind of changed how he was cooking. And he also basically went down to like stage 1, no blood pressure medications, lost weight. So had done really well with that. I had someone else who um, stage 3, I think she went to stage 2, not necessarily plant proteins, but just improved her diet, made those changes with protein and sodium and just kind of more balanced on that plate. And she also had some success. And then I had an older gentleman who was in Alaska and really liked his game meats and his desserts and so forth. But his wife was his caregiver and was really pretty diligent about things that she was doing and cooking for him. And we had a lot of different conversations on, which type of meat, how much to have. Maybe let's mix in some veggie dishes in there. And he also had some improvements from stage 4 or 5 to like stage 3. So, really kind of having a healthier plate in general, and that's going to always include more fruits and vegetables on the plate. And just really kind of, working with a dietitian, if, as able, definitely has some benefits. But even if you don't have access to a dietitian, just trying to find ways to get more fruits and vegetables on the plate, less processed foods might be the easiest kind of place to start.
Absolutely love the message there. And as plant based, and I think the default answer is if you can get as close as possible to plant based, you'll do your health a favor. And it's I think also very promising to hear that a lot within our nutrition, which is within our control, can impact our health, right? So CKD being a great example of that, and seeing to what you're saying with folks being able to, go a stage or two back there. Thank you so much for your time here, Dr. Prest. I would like for our listeners to hear from you about how they can just connect with you and learn more about your work after this episode.
Sure. So I am on um, Instagram and Facebook, but you can also just go to my website, which is knsdietitians.com. That would be the easiest way. You can email me there and connect with me.
Lovely. And to all of our listeners, thank you so much for tuning into another episode of the Yumlish podcast. You know it is that time to head over to our social media and answer this quick question. Based on the episode and what you learned today, what are the types of things that you will do to take care of your kidney health? So head over to our social media at Yumlish on Facebook as well as on Instagram. And again, find this podcast post and answer below to tell us how would you take care of your kidney based on what you learned here today on the podcast. We will continue the conversation there with Dr. Prest. Thank you so much again.
Thank you.